Deep vein thrombosis is a condition characterized by the formation of blood clots, thrombi, in the deep veins of the body, typically in the legs. Here's a breakdown of deep vein thrombosis. Deep vein thrombosis occurs when a blood clot forms in one of the deep veins, usually in the lower leg, thigh, or pelvis. This clot can partially or completely block blood flow through the vein. Several factors can increase the risk of developing deep vein thrombosis, including prolonged immobility, such as during long flights or bed rest, surgery, injury, or trauma to the veins, certain medical conditions like cancer or clotting disorders, hormonal birth control, pregnancy, obesity, and smoking. Deep vein thrombosis may cause symptoms such as swelling, pain, tenderness, warmth, or redness in the affected leg. However, some people with deep vein thrombosis may not experience any symptoms, making diagnosis challenging. One of the most serious complications of deep vein thrombosis is pulmonary embolism, where a blood clot breaks loose from the vein and travels to the lungs, blocking blood flow. Pulmonary embolism can be life-threatening and requires immediate medical attention. Diagnosis of deep vein thrombosis typically involves a combination of medical history, physical examination, and diagnostic tests such as ultrasound, CT scan, or venography to visualize the blood flow and identify blood clots in the veins. Treatment of deep vein thrombosis aims to prevent the clot from growing larger, prevent it from breaking loose and causing a pulmonary embolism, and reduce the risk of recurrence. Common treatments include anticoagulant medications, blood thinners, to prevent further clot formation and allow the body's natural clot-dissolving mechanisms to work effectively. In some cases, procedures such as thrombolysis, clot-dissolving medication, or thrombectomy, surgical removal of the clot, may be necessary. Preventive measures for deep vein thrombosis include staying physically active, avoiding prolonged periods of immobility, maintaining a healthy weight, avoiding smoking, wearing compression stockings, and for high-risk individuals, using blood-thinning medications during periods of increased risk, such as after surgery or during long flights. Overall, deep vein thrombosis is a serious condition that requires prompt diagnosis and appropriate treatment to prevent complications such as pulmonary embolism and long-term complications like post-thrombotic syndrome. Give us a call at 480-668-5000